Have you ever said to your physicians that, doctor, I am taking all my blood pressure medications and yet my blood pressure is still very high? If so, you are not alone. Millions of people faithfully take their blood pressure medication. They still struggle to get their blood pressure under control. But the good news is that in many cases, there is an explanation to it and often something that you can do about it. So on today's video, I'm going to share with you seven common reasons why your blood pressure may still be high despite taking your blood pressure medication. And also, I'll let you know when you should get in touch with your provider so that these things can be fixed. My name is Dr. Moses Frazier. I am a hospital internal medicine physician. And so today I'm going to help you to understand why this happened. And my goal is for you to live, a longer, healthier life and bringing you evidence-based information from medicine. Okay, so let's dive into it. The first reason why most people, even though they take their blood pressure medications regularly and still have uncontrolled blood pressure, is that you may not be measuring your blood pressure correctly. Yes, you had me right. Believe it or not, most people take their blood pressure, but they don't do it the right way. For example, there are a few common mistakes that people make. For example, they take their blood pressure immediately after they climb upstairs or they come down without even waiting for a few minutes. And so that is one common mistake. The second mistake is that most people talk whilst they are inflating the blood pressure cuff. That can affect your blood pressure as well, and the numbers may not be very accurate when you do that. Another thing is that people take their blood pressure crossing their legs. Yes, that also can affect your blood pressure. And also, if you have a full bladder, your bladder is full, that can also affect your blood pressure. Or just having the wrong size of the cuff, the wrong cuff size can affect the blood pressure. That is very large or very small, not the one that fits your arm, can also affect your blood pressure. So for most accurate readings, what I recommend people do is to sit quietly for about 5 minutes with your feet both flat, and your arm resting at your heart level when you're taking the blood pressure. And also making sure that you have not, taking things like caffeine or smoking, or you haven't drunk alcohol, or you are not just coming from a walk. Because these things, like I said before, will cause your blood pressure to be high, and that's by taking medications. The second reason why people may experience blood pressure being very high despite being on medication is that they are not taking their medication consistently. Because some people may miss medications over the weekend because they are busy doing stuff, or they may run out of medications and they haven't had a chance to get a refill. And all of these things can cause fluctuation in your blood pressure. In fact, certain blood pressure medications, you're not supposed to miss them. In fact, if you miss those medications, actually they'll cause what we call rebound hypertension. Your blood pressure will actually go very high. So if you're on medications like that and you're missing them, you are causing rebound hypertension, and therefore, even though you're taking medication, your blood pressure continues to remain high. So you must have a way to remind yourself when you should take your blood pressure medication. For example, now these days everybody has an Apple Watch or iPhones. You can set an alarm to take the blood pressure. Usually, if you're taking more than 2 blood pressure medications, I recommend people to take them, a certain time, particular time of the day, maybe in the morning or before bedtime. And that has also been shown to help regulate your blood pressure to give you accurate numbers. The third reason is that dietary changes. Now, remember that medication alone is not going to fix your blood pressure. Most people think once they're taking medication, that is the end of it, it's going to fix their blood pressure. But that is not true. There's a lifestyle modification, especially dietary changes. Now, some people completely restrict themselves from eating salt and they go low salt food or saltless food. No, you should not be doing that because your body needs some sodium. And so you can eat salt, but don't overeat food that are very high in sodium and low in potassium. Because if the food are very high in sodium, low in potassium, that can affect your blood pressure, even though you're taking your blood pressure medications regularly. So things like canned food, chips, deli meat, fast food, and frozen meals, all these things are very high in sodium. And so they would actually will cause retention of fluids and your blood pressure is going to go high. So just make sure you eat moderate salt. Don't completely eliminate salt from your diet. It's not, evidence-based. And so just make sure you watch your sodium intake very, very carefully when you're taking blood pressure medicine. Another reason why people's blood pressure may be very high, again, like I said, not only dietary changes, but lifestyle modifications, because several lifestyle factors can actually help keep your blood pressure actually, elevated. Things like if you have excess body weight, you're overweight, your blood pressure can be very high because of that, or you have a lot of physical inactivity, you sit on your couch all the time, watch TV, you don't move around, all those things can increase your blood pressure. So taking your blood pressure medicines, we're not going to fix that. It's something that you got to do yourself. Or if you have poor sleep or heavy alcohol intake or chronic stress can cause increased cortisol level and therefore cause increased blood pressure. And so just about 20 to 30 minutes of a walk in most days of the week can help manage your weight and actually increase blood flow and therefore to help to regulate your blood pressure in addition to the medications that you're already taking. The fifth reason why people may have high blood pressure despite taking their blood pressure medicines is that you may be taking medications that actually causes high blood pressure. And so, like I tell my patient most of the time, we call something polypharmacy, where people take a lot of medications and some of them will interact with each other to cause high blood pressure. For example, people take pain relievers like NSAIDs, ibuprofen, Advil, naproxen, Aleve. These medications, we take them chronically, will cause elevation of your blood pressure. And so despite you taking your blood pressure medicines, this can cause increased blood pressure, and therefore the medications you're taking are not going to work for you. Or if you take some decongestants for cold, they can cause, spasms of your arteries and cause high blood pressure. Or just people on steroid medications, people on stimulants like ADHD medications and also certain herbal supplements will cause high blood pressure. So make sure your provider review your medications if you are struggling to have your blood pressure under control. Despite, especially if you're taking like 2 or 3 blood pressure medications and you're still struggling, have your physician review the other medications you're taking to make sure that they are not interacting to cause high blood pressure. Okay. The next one is that people may have some underlying conditions, which if you've gone back to my channel, I talk about secondary hypertension. There are certain underlying conditions that can cause increased blood pressure despite you taking your medication. Things like kidney disease, if you have renal artery stenosis, that is the arteries going to your kidneys are very narrow, they can cause increase in blood pressure. And so if you're on 3 to 4 medications and still your blood pressure is not in control, make sure your physician check what we call secondary hypertension. And so things like sleep apnea, people who have sleep apnea or they have thyroid disease or certain hormonal disease that can have increase in blood pressure despite you taking all this blood pressure medication. Now, the last but not the least is adjustment to your blood pressure medication, because sometimes you're only taking one medicine and the dosage is very low. Maybe initially it was working for you, but later it's not controlling your blood pressure as it should. Then you must look into adjustment of your medication. Then again, don't try to adjust medications yourself. Don't adjust your medication because you may cause very low blood pressure and have trouble. So make sure you discuss with your physician to make adjustment to the dosages for you. And sometimes you may require maybe 2 medications taken at different times of the day to help manage your blood pressure if you're struggling with blood pressure that is not in control. So talk to physicians, make an adjustment, or sometimes just changing the medication type will also help with managing your blood pressure. For example, people of African American descent, they may benefit from a different group of medications than people of Caucasian descent. So these are some of the things that you may want to do if you are taking your blood pressure regularly and still it's not controlling your blood pressure, your numbers are so high. And I believe that if your blood pressure is still very high despite taking medication, these are some of the things that you need to do, because remember, blood pressure do not most of the time produce any symptoms, and they have a high risk for stroke, cardiovascular disease, and kidney diseases. So make sure that you work closely with your physician and go through some of these things that I have discussed with you, or to share this video with somebody who has high blood pressure if this information has been very helpful to you, so that together we can help live a very healthy lifestyle and be able to avoid things like stroke, heart attack, and kidney disease. Now, I'd like to hear a comment from you. Now, if you have high blood pressure, despite taking all your medications, I want you to write in the comments below, what have you done to get those numbers very low? So leave comments, subscribe to the channel, come back here regularly for evidence-based information for your health, and so that together we can live long and healthy. Until then, Dr. Moses.